Healthcare fraud exposed. Former Texas hospital CEO agrees to $5.3 million settlement in false claims case. In a significant development that underscores the ongoing challenges of maintaining ethical practices in the healthcare industry. Jeffrey Madison, the former CEO of Little River Healthcare in Rockdale, Texas, has agreed to pay a substantial sum of over $5.3 million to resolve allegations of violating the False Claims Act. This case, which has sent ripples through the healthcare community, highlights the critical importance of transparency, integrity, and compliance in medical facilities across the United States. The settlement and its implications. The settlement, announced by the U.S. Department of Justice on October 2, 2023, marks the culmination of a complex investigation that spanned several years. The allegations against Madison were initially brought to light in a 2022 lawsuit, which claimed that under his leadership, Little River Healthcare, a critical access hospital, had engaged in a series of fraudulent practices that violated federal healthcare regulations. At the core of the allegations was the submission of false claims for laboratory testing to federal healthcare programs. This practice, which allegedly occurred from January 2015 to June 2018, represents a significant breach of trust and a violation of the systems put in place to ensure fair and honest billing practices in healthcare institutions. The kickback scheme. Perhaps even more alarming than the false claims allegations were the accusations of a kickback scheme orchestrated under Madison's leadership. The Justice Department contends that Little River made illegal payments to physicians with the express purpose of inducing them to refer their laboratory testing to the hospital. This practice, if proven true, represents a clear violation of anti-kickback statutes designed to prevent financial considerations from influencing medical decision-making. One physician, Dr. Doyce Cartrett Jr. of Silsbee, Texas, was specifically named in the allegations. According to prosecutors, after Dr. Cartrett informed Little River of potential referral volume, Madison allegedly agreed to have the hospital pay the doctor $2,000 monthly under the guise of medical director fees. This arrangement, which reportedly lasted from February 2015 to May 2017, is particularly troubling as it is claimed that no actual services were provided in exchange for these payments. The sole purpose, as alleged by the Justice Department, was to secure Dr. Cartrett's referrals to the hospital's laboratory. The impact on patient care and trust. While the financial aspects of this case are significant, the potential impact on patient care and public trust in the healthcare system cannot be overstated. When healthcare decisions are influenced by financial incentives rather than medical necessity, it puts patients at risk and undermines the fundamental principles of medical ethics. Patients rely on their healthcare providers to make decisions based solely on their medical needs, not on financial gain for the hospital or individual physicians. Moreover, cases like this can erode public confidence in the healthcare system as a whole. When high-ranking officials in healthcare institutions are found to be engaging in fraudulent practices, it can lead to widespread skepticism about the motivations behind medical recommendations and treatments. The role of critical access hospitals. It's important to note that Little River Healthcare was designated as a critical access hospital. This classification is given to certain rural hospitals to reduce the financial vulnerability of rural hospitals and improve access to healthcare by keeping essential services in rural communities. The fact that a critical access hospital was at the center of these allegations raises questions about the oversight and management of these vital community resources. Critical access hospitals play a crucial role in ensuring that rural communities have access to necessary medical services. They often serve as the primary or only source of healthcare for miles around. When such institutions are implicated in fraudulent practices, it not only jeopardizes the specific hospital involved, but can also cast doubt on the entire system of rural healthcare delivery. The consequences for Jeffrey Madison. As part of the settlement, Jeffrey Madison has accepted responsibility for the allegations against him. This admission is a significant step, as it acknowledges the severity of the claims and the importance of accountability in healthcare leadership. Perhaps the most severe consequence for Madison, beyond the substantial financial settlement, is his exclusion from participation in Medicare, Medicaid, and TRICARE for a period of 25 years. This exclusion effectively bars him from involvement in any healthcare ventures that rely on federal funding. which encompasses a vast majority of the healthcare industry in the United States. This penalty underscores the seriousness with which federal authorities view violations of healthcare regulations and serves as a stark warning to other healthcare executives. The broader implications for healthcare compliance. This case serves as a potent reminder of the need for robust compliance programs in healthcare institutions of all sizes. It highlights the importance of regular audits, clear ethical guidelines, and strong oversight mechanisms to prevent and detect fraudulent activities. Healthcare executives and board members must be vigilant in ensuring that their institutions adhere to all relevant laws and regulations. This includes not only the False Claims Act, but also the Anti-Kickback Statute, the Stark Law, and other federal and state regulations governing healthcare practices, the role of whistleblowers, and qui tam lawsuits. While not explicitly mentioned in this case, it's worth noting that many similar fraud cases come to light through whistleblowers and qui tam lawsuits. The False Claims Act includes provisions that allow private individuals to file lawsuits on behalf of the government against those who have defrauded federal programs. These whistleblowers, known as relators, can receive a portion of any recovered damages, providing a financial incentive for individuals with knowledge of fraudulent activities to come forward. The existence of such provisions underscores the importance of creating a culture within healthcare organizations where employees feel empowered to report suspicious activities without fear of retaliation. Looking forward, lessons and preventive measures. As the healthcare industry digests the implications of this case, several key lessons emerge. 1. The need for strong ethical leadership in healthcare institutions cannot be overstated. Executives must lead by example and foster a culture of compliance and integrity. 2. Regular training on healthcare regulations, fraud prevention, and ethical practices should be mandatory for all staff, especially those in leadership positions. 3. Healthcare organizations should implement robust internal auditing systems to detect and prevent fraudulent billing practices. 4. Clear policies regarding physician relationships, referrals, and financial arrangements must be in place and strictly enforced. 5. Whistleblower protection policies should be strengthened to encourage reporting of suspicious activities. 6. Board oversight of healthcare organizations should include regular reviews of compliance programs and financial practices. Conclusion. The case of Jeffrey Madison and Little River Healthcare serves as a sobering reminder of the ongoing challenges in maintaining ethical practices in the healthcare industry. While the $5.3 million settlement and 25-year exclusion from federal healthcare programs represent significant punitive measures, the true cost of such fraudulent activities extends far beyond financial penalties. It impacts patient trust, community well-being, and the integrity of the healthcare system as a whole. As the industry moves forward, it must redouble its efforts to ensure compliance, foster ethical leadership, and maintain the highest standards of patient care. Only through vigilance, transparency, and a commitment to integrity can the healthcare system maintain the trust and confidence of the patients it serves.